Many people imagine that a stroke happens suddenly, like a lightning bolt in a clear blue sky. But the reality is different. It forms slowly, silently, over months and years, through nocturnal behaviors that no one perceives as dangerous. What you do in the hours before sleep may be gradually stressing your heart, blocking your circulation, and weakening your brain. And this happens more often than you think. According to data from the American Heart Association, more than 50% of strokes in elderly people occur at night, or just at dawn, exactly when the body should be regenerating. Stroke is the second leading cause of death among the elderly worldwide, but it is also among the most preventable, as long as you recognize and eliminate the right behaviors. In this video, I will show 8 extremely risky nighttime behaviors for brain health. They are gestures that seem harmless but drastically increase the chances of blood clots, brain microlesions, and hemorrhages while you are sleeping. Correcting just one of these behaviors can quickly and significantly reduce this danger. Stay until the end, because the last habit on the list is the most underestimated, the most common among the elderly, and also the most lethal. If you are over 60 years old, or if you care for someone of that age, this video could be the warning that saves a life. Your bedtime routine may be harming you without you knowing every day. Let's start. And turn your nights into your greatest brain defense mechanism. Habit number 1, forgetting or taking nighttime medications irregularly. Taking a pill before going to bed may seem like a small mistake, but in old age, this oversight can have serious consequences, especially when it comes to medications for controlling blood pressure, cholesterol, or heart rhythm. These medications are not just symptomatic. Most were developed to act specifically during the early morning hours when the risk of stroke reaches its peak. During sleep, the body makes delicate adjustments to blood pressure, heart rhythm, and cerebral circulation. If a medication is forgotten or taken at the wrong time, this protection fails, and the brain is exposed at its most vulnerable moment. A study published in the journal Chronobiologia International revealed that proper adherence to antihypertensive schedules reduces the risk of nocturnal cardiovascular events, including stroke, by up to 60% and more. Trying to compensate by doubling the dose in the morning does not solve the problem. On the contrary, it can completely destabilize the body. Unfortunately, many elderly people still take medications when they remember or when they can. But this irregularity is dangerous. The body needs consistency. It is this that allows the medications to work with maximum effectiveness, stabilizing blood pressure and protecting the brain vessels throughout the night. To maintain this regularity, use a pill organizer with days and times. Set reminders on your phone. Associate the medication time with a fixed habit, like brushing your teeth or putting on pajamas. Small adjustments in your routine create an invisible barrier around your brain. Do not underestimate a nighttime capsule. It could be your most discreet shield against stroke. Habit number 2, sleeping angry or emotionally disturbed. Going to bed angry, anxious, or with any kind of emotional turbulence may seem insignificant. But for those over 60, this behavior becomes a silent threat to the body. When you lie down with a restless mind, the brain interprets it as still being under threat and reacts by releasing hormones like cortisol and adrenaline, which raise blood pressure, speed up the heartbeat, and constrict blood vessels. This imbalance is particularly dangerous at night. Research published in the journal Hypertension has shown that high levels of emotional stress before sleep are directly related to pressure spikes during the early morning hours and a higher incidence of cerebrovascular events, such as stroke. And the most serious part is that this stress does not disappear just because you fall asleep. On the contrary, it continues to feed the body with tension throughout the night, preventing deep sleep and overloading the brain at a time when it should be repairing itself. I remember a 72-year-old patient who arrived at the hospital after a minor stroke. During the conversation, we discovered that she had the habit of discussing complicated financial matters with her family just before bed. After guidance and changes to this routine, she not only improved her sleep, but also managed to stabilize her blood pressure remarkably. Many elderly people minimize their emotions, thinking that it's not worth getting upset. But going to bed carrying heavy feelings is like sleeping with a triggered danger alarm. And night after night, this emotional buildup turns into chronic inflammation, persistent hypertension, and weakening of brain health. If you had a difficult day, don't carry that burden to bed. Take a deep breath, write, meditate, talk. Even 5 minutes of tranquility before lying down already helps reduce stress levels and can protect your brain. Emotional serenity is not a luxury. It is protection. In old age, peace before sleep is a shield against stroke. Habit number 3, drinking a large amount of liquids before sleeping. Staying hydrated is essential for health, especially in old age. But when this hydration happens at the wrong time, just before lying down, the effects can be much more dangerous than you might imagine. Many elderly people have the habit of drinking large volumes of water, tea, or other liquids before going to bed. The problem is that this significantly increases the chances of nighttime interruptions, with frequent trips to the bathroom that break deep sleep cycles. And it's not just the quality of rest that suffers. Every time the body suddenly gets up from bed, blood pressure experiences a sudden fluctuation, the heart speeds up, and the risk of dizziness, falls, and even stroke increases. A study published in the Journal of Clinical Gerontology and Geriatrics showed that frequent awakenings to urinate are directly associated with transient increases in blood pressure and a higher incidence of nocturnal vascular events in the elderly. Moreover, fragmented sleep prevents the brain from entering deep restorative phases, the same responsible for toxin cleaning, mood regulation, and blood vessel repair. This does not mean you should drink less water. It means you need to drink at the right time. Ideally, distribute fluid intake throughout the day and reduce the volume in the last 2 hours before sleeping. If you already have frequent episodes of nighttime urination, or if you use diuretic medications, talk to your doctor about the possibility of adjusting timings and doses. Good sleep is not just about the number of hours. It is about consistency, depth, and internal stability. And avoiding excess liquids at night is a simple gesture that can preserve your balance and protect your brain. Habit number 4, sleeping with uncontrolled hypertension. Going to bed with high blood pressure is one of the riskiest behaviors for an elderly person's brain, and unfortunately, also one of the most common. During the night, the body should enter a state of deep rest, allowing the heart to slow down and the blood vessels to relax. But when blood pressure remains high, the arteries stay tense, forcing the heart to work harder and putting the brain at risk. This condition is known as nocturnal hypertension. And the most frightening part is that it usually presents no symptoms. According to the American Heart Association, elderly people with uncontrolled nocturnal hypertension have up to twice the risk of suffering a stroke during sleep, especially in the early morning hours when most cases occur. And the reason is clear. When blood pressure does not drop at night, the walls of the brain's blood vessels become more vulnerable, favoring both clot formation and rupture of small vessels, which can cause severe brain hemorrhages. The problem is that many people only measure their blood pressure during the day and believe that everything is under control. But the greatest risk may actually be during those hours when no one is paying attention. If you often wake up tired, with a headache, blurred vision, or a feeling of heaviness in your body, it may be a sign that your blood pressure is high during the early morning hours. The only way to know for sure is by measuring at home, at night, or upon waking. Talk to your doctor about nighttime monitoring, or consider using an automatic wrist monitor while sleeping, and, if necessary, adjust the medication schedule so it provides protection during the most critical hours. Controlling blood pressure at night is one of the most effective ways to protect your brain after 60. Don't wait for a scare. Act while there is still time. Habit number 5. Sleeping in an environment with excessive lighting. Many people think it's normal to sleep with the TV on, a bedside lamp lit, or even the hallway light entering the room. But this seemingly harmless habit can be silently sabotaging your brain during the night. Exposure to bright light at night directly interferes with the production of melatonin, the hormone that regulates sleep and helps the body enter a state of deep rest. Without this hormone, the body does not fully relax, blood pressure does not drop as it should, and the nervous system remains alert, even with the eyes closed. Studies published in the journal Sleep Health have shown that elderly individuals exposed to light during sleep have a higher risk of hypertension, type 2 diabetes, and cardiovascular events such as stroke. And the worst part, most of these people are not even aware that the light is causing so much damage. The body needs total darkness to regenerate the brain, restore hormonal balance, and clear accumulated toxins throughout the day. When there is light, whether from a screen, a lamp, or even a window without curtains, the biological clock gets confused, sleep rhythm is disrupted, and brain health begins to deteriorate. If you have the habit of sleeping with the television on, try turning it off at least 30 minutes before going to bed. If there is too much external light, use blackout curtains. And if you need a light for safety, prefer amber-toned, dim lights directed toward the ground. Sleeping in the dark is more than comfort. It is a biological necessity, and it can be one of the simplest and most effective ways to protect your brain while you sleep. Habit number 6. Ignoring loud snoring or sleep apnea. Snoring may seem just an annoyance for the person sleeping next to you, but in fact, it can be one of the most alarming signs that the brain is in danger. Loud snoring, especially when accompanied by pauses in breathing during the night, can indicate a serious condition called sleep apnea. Sleep apnea causes breathing to stop and restart multiple times while you sleep. Each interruption temporarily cuts off oxygen to the brain. This triggers a chain reaction. Blood pressure rises, heart rate accelerates, and the risk of stroke increases drastically. A study published in the Journal of Clinical Sleep Medicine revealed that elderly individuals with moderate to severe sleep apnea have up to 4 times the risk of suffering a stroke compared to those who breathe normally during sleep. The most dangerous part is that many people are unaware they have the problem. People who live alone, for example, rarely notice the signs, such as nighttime choking, pauses in breathing, or excessive fatigue upon waking, even after a full night's sleep. I had a 69-year-old patient who discovered his sleep apnea only after an episode of extremely high blood pressure during the early morning hours. After starting treatment with CPAP, not only did his sleep improve, but his blood pressure also stabilized impressively. Sleep apnea not only prevents the brain from recovering properly, but also accelerates the degeneration of cognitive functions and weakens the cardiovascular system. If someone has ever commented that you snore very loudly, or if you wake up with a headache, dry mouth, or a feeling of suffocation, do not ignore it. Seek a doctor. Today, there are many effective treatments, from simple lifestyle changes to the use of respiratory devices during the night. Breathing well while sleeping is essential for brain health. Do not treat snoring as something normal. Sometimes it is the only warning the body gives before it is too late. Habit number 7. Sleeping in inadequate temperatures without thermal protection. Sleeping in a slightly cool environment may even be recommended for sleep. But when the room is too cold and the body is not properly warmed, the effect can be exactly the opposite, harmful and dangerous, especially for the elderly. During sleep, body temperature naturally decreases. But if the environment is very cold and you are not well protected with blankets or appropriate clothing, the body is forced to react to stay warm. This reaction activates the sympathetic nervous system, the same that comes into action in stressful or dangerous situations. This state of alert narrows blood vessels, raises blood pressure, and increases heart rate. A study published in the Journal of Hypertension showed that exposure to low temperatures during the night is associated with blood pressure spikes and a higher incidence of cardiovascular events, such as heart attacks and strokes, especially among the elderly. Additionally, excessive cold interrupts the natural sleep cycle, causing nighttime awakenings, muscle stiffness, and even chills, signs that the body is struggling to maintain thermal stability. If you often wake up with cold hands or feet, or if you feel tired even after a long night of sleep, you may be sleeping in an inappropriate environment. The ideal is to keep the room between 18 and 21 degrees Celsius, use enough blankets, wear warm pajamas, and avoid direct drafts from the fan or window. The body needs rest, not resistance to cold. Ensuring a comfortable temperature during the night can be one of the most effective ways to protect your heart and brain while you sleep. Habit number 8, sleeping sitting in a chair or armchair instead of in bed. It may seem harmless, dozing off in the armchair after dinner, falling asleep while watching television, or even spending the entire night sitting out of laziness to get up. But this habit, which many elderly people consider harmless, is one of the most dangerous for circulation and the brain. Sleeping hunched in a chair, with the neck tilted or the body without proper support, restricts blood flow to the brain and heart. This position impairs brain oxygenation and, over time, can promote the emergence of silent microbleeds, small lesions that go unnoticed but accumulate and impair memory, coordination, and lucidity. Neuroimaging studies, such as those published in the journal Stroke, show that elderly people with poor postural sleep quality have a greater number of cerebral ischemic lesions and a higher risk of stroke. In other words, how you sleep matters, and a lot. Additionally, sleeping outside the bed makes it difficult to enter deep sleep phases, reducing the release of restorative hormones and limiting the body's ability to regenerate during the night. The brain needs darkness, silence, and, most importantly, proper posture to do its nightly work of cleaning, protection, and recovery. Many elderly people find it more practical to fall asleep in a chair, but this practicality comes at a very high cost. Choosing to sleep correctly is choosing to take care of your own future. Invest in a dark, quiet, and comfortable environment. Use supportive pillows, align your spine, and always lie on an appropriate bed. Sleeping well is not a luxury. It is a survival strategy. Switching from a chair to a bed can be the difference between protection and risk for your brain. Now that you know the 8 habits that silently increase the risk of stroke during the night, it's time to turn the page. Because the truth is that none of these habits need to continue being part of your life. You can change with awareness, consistency, and small choices made every day before sleeping. Protecting your brain doesn't require magic formulas or empty promises. It only requires attitude, choosing the right rest, taking medications at the right time, sleeping in the right position. It seems little, but this is what builds or destroys your brain health over the years. Don't wait for a shock to act. Stroke is often silent, but so is prevention, and it begins with simple decisions that only you can make. Therefore, if this content has alerted you, share it with those you love. Send it to the person who snores and thinks it's normal, to those who say they always sleep in the armchair, to those who take medication when they remember. You can help save a life. And if you are committed to your own protection, comment below, "I choose to take care of my brain every night." That way, I will know that you understand the power you hold and are ready to use it. Your night can be a risk, or it can be your greatest protection. You are the one who decides. See you in the next video, with more tips on health, prevention, and a long life for those over 60, but still with a lot ahead.